Hello, so today I'm going to be demonstrating two nursing skills, and those are administration of oral medications and administration of medication via G-tube. So I'm going to begin by doing the administration of oral medications. So I'm going to be reading through the skills as I practice on my patient Steve, the fish. So the first thing I'm going to do in the assessment category is avoid distractions. I'm going to check the medication administration record. So I'm going to look at the date, the patient's name, the drug name and dosage, the time for administration, and the route of administration. Next, I'm going to check the patient's chart for allergies, parameters for possibly holding the medication, the NPO status, any swallowing problems, or any fluid restrictions for the patient. For the planning category, I'm going to identify expected outcomes, no actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of medications to be administered. I'm going to identify what teachings I might need to provide Steve, the fish. I'm going to gather my equipment, the EHR, medication cups and tray, and then water if necessary. For the implementation of this skill, I'm going to get the med cart. I'm going to perform my hand hygiene. I'm going to state the 6 rights of medication administration, which are right patient, right drug, right dose, right time, right route, and right documentation. I'm going to read the medication administration rights and select the correct medication, which is the first check. I will then check the expiration date and repeat it more than one medication is to be administered. I will compare the medication administration rights label to the medication container and verify that it is the correct medication. That will be my second check. I will verbalize that I will need to calculate the correct amount of the drug to be given. I will place unopened unit dose medications in the cup. I will then place floor, stock, and liquid medications in separate cups. When removing tablets or capsules from a bottle, pour the necessary number into bottle cap and then place tablets in a separate medication cup. When pouring liquid medication, set the cup on a flat surface and read the level of liquid at the lowest point of meniscus. Palm the label of the bottle so medication does not drip on the label. Next, I'm going to check the label of all medications comparing to medication administration rights before returning the bottles to the storage. That will be my third check. I'm going to carry prepared medication and medication administration rights to a patient's room. Upon entering the room, I am going to perform hand hygiene. Be aware of your spatial safety. Have call light within reach. I'm going to identify myself. Hi, Steve. I'm going to be your nurse. I'm going to identify Steve. Steve, can you tell me your name and date of birth? I'm going to ask Steve if he has any allergies. I'm going to assure privacy by pulling the curtain. I'm going to explain what is about to occur, that I'm going to be administering his medication. I'm going to allow Steve to give me any questions. So Steve, do you have any questions? I'm going to raise the bed to a comfortable working height for myself. I'm going to perform necessary assessments like blood pressure, pain, apical heart rate to determine if the medication should be withheld. I'm going to position the patient to facilitate comfort in swallowing medications. For unit dose medications, I will scan the patient wristband, scan the medications, compare each medication to medication administration rights, correctly record medication on medication administration rights, collect data such as pain level, blood pressure, pulse, medication given and dose, time, and route. When I administer the medication, I can offer water or other permitted fluids with pills, capsules, tablets, and some liquid medications. Ask the patient's preference about taking medications and record any fluid intake if necessary. And then prior to leaving, I lower the bed, raise the rails, give them the call light, and perform hand hygiene. Now, for the next skill, the G-tube feeding. the first thing I do is avoid distractions, check the medication administration records, check the date, the patient's name, drug name and dosage, time for administration, and route of administration. I will next check the patient's chart for allergies, parameters for possibly withholding the medications, diet, NPO status, fluid restrictions. I will identify expected outcomes, know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of medications to be administered. I'll check the pharmacist regarding substituting tablets, gel caps, capsules, or sustained release medications for liquid form. Ensure that the contents of capsules can be expressed from the covering. Identify what teachings I might need to provide to Steve. Gather my equipment, and that would be gloves, tongue depressor, blue pad, irrigation syringe, irrigation bottle with tap water, source of water for dissolving medications, pill crusher, and stethoscope. Deliver supplies to patient's room. Identify myself and purpose for the delivery when placing items on bedside table. I will go over to the med cart, perform hand hygiene. I will state the 6 rights of medication administration, and that would be right dose, right patient, right time, right route, right drug, and right documentation. Then I will read the medication administration rights, check the expiration date, repeat if there's more than one medication to be administered, and that is my first check. Next, I will compare the MAR to label on medication container. That is going to be my second check, and I'm going to verify the medication, and I will repeat if there's more than one medication. I will verbalize that I'm going to be calculating the correct amount of drugs to be given. Next, I'm going to prepare medication. I'm going to verify that medication to be administered does not include any sublingual, enteric-coated, or sustained release medications. I'll put each unopened medication in a separate medication cart. Check the labels of all medications. Carry them on a tray to the patient's room. Upon entering the room, I will perform hand hygiene. Be aware of my spatial safety. Identify Steve. I could use name and date of birth. Ask Steve if he has any allergies. I will ensure privacy. I can do that by pulling the curtain. I'll explain what is about to occur. Ask Steve if he has any questions. Raise the bed to a working height. And if necessary, I can check apical heart rate, check blood pressure, do a pain. Ask if Steve has any pain, abdominal discomfort, tenderness, or any abnormal bowel sounds. I will then position the bed to high Fowler's. I will then don gloves, position the stethoscope just below the costal margin. I will instill air into the tube while listening through the stethoscope. I will check for residual, aspirate the stomach contents, return aspirated contents of stomach unless the volume exceeds 250 milliliters. Follow facility policy for medical administration. And when I prepare for administration, I scan the patient ID band, scan the medication, correctly record intake and output for fluids, and then prepare the medication based on tablets, capsules, and liquid. And then, finally, when administering the medication, I want to stir and pour dissolved medications into syringe and allow it to flow by gravity into the feeding tube. To administer more than one medication, I'll have to flush in between. Follow the last medication with 15 to 30 milliliters. Remove the tube, and then prior to leaving the room, lower the bed, raise the handrails, give them the call light, and perform hand hygiene. And that'll be it. And for evaluation, verbalize the need to follow up therapeutic effects on medication if necessary. And I kept it under 10 minutes. Thanks for watching.